Good morning, everyone. Bonjour tout le monde. Aujourd'hui, je suis
Today,
avec ma collègue, la
I am
ministre
with my
Haidou et le ministre
colleagues,
Miller,
Minister Haiju and
et
Minister Miller.
évidemment, la Dr Tam,
Obviously,
le
Dr.
Dr New et
Tam,
le
Dr.
Dr
New,
Wang
and
sont
Dr.
aussi
Wang are
avec nous
also
à
here with
Ottawa.
us today in Ottawa.
Yesterday, we had a great meeting with Canada's First Ministers, and as the Prime Minister said, we continue to work collaboratively today and tomorrow on the priorities of Canadians, including obviously the continued fight against COVID-19 and the federal, provincial, territorial collaboration in terms of healthcare, vaccinations, and the other important priorities that Canadians have asked us to continue to work collaboratively on together. Je tiens à remercier tout particulièrement
I'd like to
tous les
particularly
médecins,
thank all
les
the
infirmiers
doctors,
et leurs équipes
nurses, and their
pour les
teams
heures qu'ils
for the
consacrent
hours
à
that they
travers
are
le pays
devoting
à aider
across
les
the country
Canadiens
to
et à
help
lutter
Canadians
contre la
and to
COVID-19.
fight
I
COVID-19.
know that this is a Team Canada effort in the coming weeks as we focus on the delivery of vaccines. We know how important this delivery is, and it is why the Government of Canada, as we told the premiers yesterday, will incur 100% of the cost of the vaccines, the logistic, the transportation necessary to ensure that every Canadian can have access to a vaccine for free. And I would now like to turn to my colleague, Patty Haidu, to say a few words. Patty.
Merci Dominique, un beau matin.
Thank you, Dominic. Good morning. We have good news this week concerning the vaccine. As everyone else in the country, I am delighted that we will be able to begin vaccination after approval of the first COVID-19 vaccine. However, the doctors that Dr. Tam and Dr. New will present in a few minutes are worrying. We are still facing a fast increase in the number of people suffering from COVID-19. Unfortunately, this also means an increase in the number of deaths.
We had some good news this week with the arrival of an effective vaccine, the approval of an effective vaccine, but we are not out of the woods yet. And Dr. Tam and Dr. New shortly will illustrate the newest modeling that will highlight the fact that COVID-19 is still presenting a very clear danger to Canadians all across the country. We know that the vaccine is an important part of the solution in stopping spread and reducing deaths, but we have a lot of work to do together as a country in the next several months. And so I'm encouraging people to continue to take care of each other, to follow the public health advice that we all know so well, to stay close to home, to stop gathering, to reduce our contacts, and to wear a mask whenever we are in close contact with others and out in public. Also, to make sure that you download the COVID alert. This is a very useful tool, as we have seen across the country. It is a way to help the public health officials that are working so hard to do that contact tracing and protect all of us as we come into contact with one another, even casually. As I said to my children, it's also a great way to protect the people that you care about, even anonymously. So my message today to Canadians is that we're entering into a very tricky period of time. Of course, it's the holiday season. Many of us are looking forward to a rest from our workplaces and an opportunity to have some downtime. But we're going to have to be very, very cautious during the next several weeks to protect those people who are counting on us to work together. Thank you very much.
Thank you, Patty. And now, Mark Miller.
Kwe Ulukut Tanse, hello, bonjour. 2 days ago, Health Canada approved the Pfizer vaccine, and this is encouraging news. However, First Nations, Inuit, and Métis have historically endured and continue to endure systemic racism and discrimination when seeking healthcare, resulting in mistrust in Canada's healthcare systems. We will continue to work with partners to increase cultural safety and respect for Indigenous peoples when planning the COVID-19 vaccine and addressing the hesitancy that is around it. The COVID-19 Vaccine Working Group at Indigenous Services Canada works collaboratively to provide an integrated and coordinated approach to support the administration and planning of process of COVID-19 and vaccine in communities. The logistics of a COVID-19 vaccine will require coordination with Indigenous communities, provinces, territories, and other partners. Les Premières Nations, les Inuits et les Métis ont historiquement
The First
subi et
Nations,
continuent de
the
subir les
Inuit, and the
conséquences
Métis
du
have
racisme et de la
historically endured and
discrimination
continue to endure
systémique.
the consequences of
Ce
racism
racisme ainsi que les
and
expériences
systemic
troublantes vécues par
discrimination.
certains
This
entraînent une
racism, as
méfiance
well as troubling
justifiée
situations experienced by
l'égard des
certain,
réseaux de
have
santé du
resulted
Canada.
in justified mistrust
La
of Canada's
logistique
health
derrière
care
le
system.
déploiement d'un vaccin contre la
The
COVID-19
logistic behind
exigera
a
une coordination
COVID-19
et
vaccine
une
rollout
collaboration avec les communautés
requires
autochtones, les provinces,
coordination and
les territoires
collaboration with
et d'autres
Indigenous
partenaires.
communities, provinces, territories, and other
The
partners.
vaccine is encouraging news. However, I must remind everyone to stay vigilant. And Tom, my Chief Medical Officer, will go through the numbers in Indigenous communities shortly. This will be a difficult month for many, series of months, in fact. The colder months mean spending more time indoors and also mean higher risk of spreading and getting COVID-19. We see this trend already across Canada, across all populations, and I can't stress enough the importance of following the public health guidelines. Those measures are in place because they work and they save lives. We've seen recent outbreaks in remote and isolated communities and recent increases in cases. They're extremely alarming. We must anticipate and prepare for more in the coming weeks. It's crucial that we get this right as the second wave of COVID-19 pandemic encroaches on Indigenous communities across the country. In the past few days, the communities of Shamattawa and Manitoba and Fond du Lac and Saskatchewan have requested the help of the Canadian Armed Forces to work alongside members of the communities and provincial partners to address immediate needs. As the situation develops, we will continue to assess the requirement for military support in the area through on-the-ground reporting in coordination with our whole-of-government partners, including Public Safety and Indigenous Services Canada. One thing that's been reinforced over the past several months is this. When local Indigenous leadership have the necessary resources, they are the most successful in responding to the crisis with immediate, innovative, and proactive measures to ensure the safety of their people. This is the driving force, among other things, behind the Indigenous Community Support Fund, which has been designed to provide the maximum flexibility so that funding could be directed to where it's most needed. Jusqu'à présent, nous avons investi plus d'1 milliard
So far, we have
dollars dans
invested
le
more
Fonds de
than
soutien aux
$1 billion
communautés
in the
autochtones, un
Indigenous
total de 4
Community
milliards
Support
en
Fund,
soutien
for
direct aux
$4
communautés
billion
autochtones.
direct
Ce fonds a
support to
joué un rôle
Indigenous
important
communities.
en promouvant la
This
sécurité
fund plays an
alimentaire, en
important role
améliorant
in
les
promoting
services de
food
soutien
security,
en santé
improving
mentale
mental health
et en assurant
services,
la
and
distribution d'équipements
ensuring that
d'urgence,
emergency equipment
ce qui
is
permet de répondre
distributed, which
à
means
vos
that
priorités et à vos rythmes dans les
we
communautés.
can answer your
We know
priorities at
there is
your
a lot
pace.
more work to do, and we will continue this work in true partnership with First Nations, Inuit, and Métis to achieve our objective. Miigwech, Nakumik, Merci Cho, thank you, et merci.
Merci beaucoup, Marc. On va tourner maintenant
Thank you
au
very much,
Dr. Wong.
Mark. We'll now go to Dr. Wong.
Good morning, bonjour. I want to acknowledge that I'm on the unceded territory of the Algonquin people. As of December the 10th, a total of 5,675 First Nations on reserve COVID cases have been reported, with 2,100 having active infection. It is distressing that the number of active cases has doubled in the past month, and the current number of active cases is over 20 times higher than the peak number during the first wave of the pandemic for First Nations on reserve. Sadly, there have been 49 on reserve fatalities. This is in the context of over 13,000 deaths in Canadians. The recent surge in cases and deaths in the general Canadian population and in Indigenous people is heartbreaking. We must do everything we can to protect our elders from this COVID pandemic. We need to listen to the evidence-based advice of the National Advisory Committee on Immunization about the need to prioritize frontline healthcare workers, long-term care settings, seniors, together with Indigenous peoples who are disproportionately impacted by COVID-19. It is imperative that First Nations, Métis, and Inuit be partners in the co-planning for culturally safe and equitable access to the vaccine in both rural, remote, and urban areas. We need to walk down this path together so that no one is left behind. Miigwech, Nakumik, merci, and thank you.
Merci beaucoup, Dr. Wong. Thank you.
Thank you,
we'll now
Dr.
turn to Dr. Tam and Dr. New.
Bonjour, good morning. Today we are going to be providing an update on the national epidemiology and modeling work. Currently, there are over 73,200 active cases in Canada, up from 52,000 just 3 weeks ago. Despite over 440,000 cumulative cases, just over 1% of the Canadian population has tested positive for COVID-19 to date. This is an important reminder that the vast majority of Canadians remain susceptible to infection.
Bonjour à toutes et à tous. Aujourd'hui, nous
everyone.
ferons le point
Today,
sur les
we'll provide
travaux
an update
d'épidémiologie
on the
et de
national
modélisation
epidemiology
effectués
and
au
modeling
pays
work
qui orientent la
that
gestion actuelle
informs
de la
the ongoing
COVID-19 au
management
Canada.
of COVID-19
À ce
in
jour,
Canada.
on totalise plus de
Currently, there are over
73 200 cas actifs au
73,200
Canada,
active cases in
comparativement
Canada,
à
up
52 000
from
il y a à peine
52,000
3
just 3
semaines.
weeks ago.
Malgré le fait que nous ayons
Despite
atteint plus de
over
440 000 cas cumulatifs cette
440,000
semaine, un
cumulative
peu plus de
cases,
1% de
just
la
over
population
1%
à
of
travers
the
le pays
Canadian
a
population
reçu un
has
résultat
tested
positif
positive
à
for
ce jour.
COVID-19 to date.
Ceci est un rappel
This is an
important du fait
important
que la grande
reminder
majorité
that the
des
vast
Canadiens et des
majority of
Canadiens
Canadians
demeurent à risque de
remain
développer
susceptible
l'infection.
to infection.
So the resurgence of COVID-19 in Canada clearly shows that the current daily case count far exceeded the peak of the first wave. And on the average, over 6,500 cases are being reported daily. And there's little indication this upward trajectory will change without further intensifying public health measures. Notably, about 100,000 new cases have been reported across the country in just the last 3 weeks.
Diapositive 2. La résurgence de l'épidémie de
Slide 2.
COVID-19
The
au
resurgence
Canada
of the COVID-19
montre
epidemic
clairement
in
que le nombre
Canada
de cas
clearly
quotidiens
shows that
actuels
the current
dépasse
daily
de beaucoup
case
le pic
count
de la première
far
vague.
exceeds the peak
En
of the
moyenne,
first
plus de
wave.
500 cas sont
On
maintenant
average, over
rapportés chaque jour
6,500
et
cases are
rien
being reported
n'indique que
daily,
cette
and there is
trajectoire
little indication
ascendante
that
va
this
changer
upward trajectory
sans une
will change
intensification des
without
mesures de
further
santé publique.
intensifying public health
De plus,
measures.
environ 100
Notably,
000 nouveaux cas ont
about
été signalés dans
100,000
tout le
new
pays
cases
au
have
cours
been
des 3
reported
dernières
across the
semaines
country
seulement.
in just the last 3 weeks.
Slide 3. Continuing rapid growth of the epidemic in Canada is being driven primarily by the 6 provinces west of the Atlantic region. In recent weeks, each of these provinces marked their highest daily case count, and sadly, several have also observed their highest daily number of deaths to date. Community-level public health measures have been strengthened, but we have yet to see the kind of sustained decline in daily case counts that would indicate we are bringing the pandemic under control.
Diapositive 3. La
Slide
croissance
3.
rapide actuelle de l'épidémie au
Continued
Canada
rapid growth of
continue
the
d'être
epidemic in
principalement
Canada is being
due
driven
au taux
primarily
élevé d'infection
by
dans
the
les 6
the
provinces à
elevated
l'ouest de la région
infection rate in the
atlantique.
provinces
Au
west of
cours
the
des
Atlantic
dernières semaines,
region.
chacune de ces
In
provinces
recent
a
weeks, each
enregistré
of these
son plus
provinces
grand
marked
nombre de
their
cas
highest
quotidiens
daily case
et,
count, and
malheureusement,
sadly,
plusieurs ont
several
également
have also
rapporté
observed
le
their
plus grand
highest daily
nombre de
number of
décès
deaths
quotidiens
to date.
à ce jour. Les mesures de santé publique au
Community-level
niveau
public
communautaire
health
ont été
measures have been
renforcées
strengthened
partout au
across Canada,
Canada, mais on
but we have yet to
n'enregistre
see
pas encore le type de
the
baisse
kind
soutenue
of
de nombre de cas
sustained
quotidiens
decline in
qui
daily case
indiquerait
counts
que nous
that would
maîtrisons
indicate
la
we are
pandémie.
bringing the pandemic under the control.
Slide 4. Since the last modeling update, the number of health regions reporting over 100 cases per 100,000 population in dark blue has increased from 30 to 49 as rapid growth expands to more areas. Alberta, Manitoba, and Saskatchewan continue to have the highest infection rates, particularly in urban centers, but rural and remote communities are being impacted as well. Atlantic provinces, including Nova Scotia and PEI, that only recently reported community transmission, were able to quickly implement a range of public health measures to interrupt spread. Likewise, New Brunswick's quick response prevented further spread from a super spreader event, allowing several regions to return to lower-level restrictions. In Nunavut, a 2-week territorial-wide restriction period started in response to an imported case and sharp spike in locally acquired cases. This quickly reduced case counts in the territory.
Diapositive 4. Depuis la dernière mise à jour
Slide
de la
4.
modélisation,
Since the
le
last
nombre de
modeling
régions
update,
sanitaires
the number
signale
of
plus de
health
100
regions
cas par
reporting
100 000
over 100
habitants. Ce
cases
sont
per
les régions
100,000
le
people,
foncé est
those are the
passé de
dark blue
30 à
regions,
49.
has
La
increased from
croissance
30
rapide
to 49
s'étendant
as
à un
rapid
nombre
growth
accru de régions.
expands to more areas.
L'Alberta, le Manitoba
Alberta,
et la Saskatchewan
Manitoba, and
continuent d'avoir
Saskatchewan
les taux
continue to have
d'infection
the
les
highest
plus
infection
élevés,
rates,
tout particulièrement dans
particularly
les
in urban
centres
centers,
urbains. Mais les
but
communautés
rural
rurales
and
et
remote
éloignées sont
communities are being
également touchées.
impacted as well.
Les provinces de l'Atlantique,
Atlantic
dont la
provinces,
Nouvelle-Écosse
including
et
Nova
l'île du
Scotia and
Prince-Édouard, qui
PEI,
ont tout
that
récemment
only
signalé
recently
une
reported
transmission
community
communautaire,
transmission,
ont mis en
were
œuvre
able to
rapidement une
quickly
série de mesures
implement
de
a
santé
range of
publique
public
pour
health measures to
interrompre la
interrupt
propagation.
spread.
De même, la
Likewise,
réaction
New
rapide
Brunswick's
de
quick
Nouveau-Brunswick
response
à un
prevented
événement de
further spread
superpropagation
from a super
a
spreader
prévenu une
event,
propagation additionnelle et
allowing several
permis à
regions
plusieurs régions de
to
revenir
return
à des
to lower
restrictions
level
de niveau
restrictions.
inférieur. Au Nunavut, une période de
In
restriction de
Nunavut,
2
a
semaines
2-week
appliquée sur
territory-wide
l'ensemble
restriction
des
period
territoires en réponse à une
in
importation,
response to an
à
imported
une forte
case and
augmentation
sharp
de
spike in
cas
locally
acquis
acquired
localement, a
cases
rapidement
quickly
réduit le
reduced
nombre
case
de cas
counts
dans le
in the
territoire.
territory.
Slide 5. The percentage of people who test positive for COVID-19 is another important indicator to monitor how hard we're looking to find cases and to gauge how much the virus is spreading. Based on the WHO international benchmark, countries should aim to keep the percentage positive to under 5%, as anything above this would indicate we're not testing enough. The average percentage of people testing positive in Canada has been increasing for many weeks, and the national percent positivity remains above the benchmark at 6.5%. As well, spikes of up to 10% or higher test positivity in several provinces signal a need to increase testing to detect and isolate a growing number of cases in the community.
Diapositive 5. Le pourcentage de
Slide
personnes
5.
obtenant un
The
résultat
percentage of
positif pour la
people who test
COVID-19
positive for
est un autre
COVID-19
indicateur
is another
important
important
permettant de
indicator to
monitorer
monitor
à
how
quel point
hard
nous
we are
cherchons
looking to find
à trouver les
cases
cas et
and to
à
gauge
évaluer à
how
quel
much
point
the
le virus
virus
se
is spreading.
propage. Selon le document de référence
Based on
international
the
de l'OMS,
World Health
les pays
Organization
devraient viser à
International
garder le
Benchmark,
pourcentage de
countries should aim
positivité
to keep
sous
the
les
percentage
5%,
positive
tout
to under
pourcentage supérieur
5%,
étant
as
susceptible
anything above
d'indiquer
this
que nous ne
could
testons
indicate
pas
we are
assez.
not testing enough.
Le pourcentage moyen des personnes
The
ayant
average
obtenu un
percentage
résultat
of people
positif
testing
augmente au Canada
positive in
depuis
Canada
plusieurs
has been
semaines
increasing
et
for
se
many
situe
weeks,
maintenant
and the
au-dessus
national
du
percent
pourcentage de
positivity
référence
remains
à
above the benchmark at
6,5%. De plus,
6.5%.
des pics allant jusqu'à
well,
10%
spikes
ou
of up
plus
to
de
10%
positivité
or
des
higher
tests dans plusieurs
test
provinces
positivity in
indiquent
several
qu'il est
provinces
nécessaire d'augmenter
signal
le
a
nombre
need
de
to
tests pour
increase testing
détecter
to
et
detect and
isoler un
isolate
nombre
a
croissant de
growing
cas
number
dans la
of cases
communauté.
in the community.
Slide 6. Across Canada, the incidence of COVID-19 has been consistently high in all age groups for many weeks. However, incidence is highest and continuing to escalate among adults 80 years and older who are at high risk of severe outcomes, including death.
Diapositive 6. D'un bout à
Slide
l'autre du
6.
Canada,
Across
l'incidence de la
Canada,
COVID-19 a été
Incidence of
élevée, et ce,
COVID-19
de
has
manière
been
constante
consistently
dans tous les
high
groupes
in
d'âge
all
depuis
age groups
plusieurs
for
semaines.
many weeks.
Cependant,
However,
l'incidence est plus forte
incidence is
et est
highest
en
and
augmentation
continuing to
constante
escalate
chez les
among
personnes de
adults
80 ans
80
et
years
plus
and
qui
older
sont à risque
who are
élevé
at high
d'issues de
risk for
santé
severe
majeure, incluant le
outcomes,
décès.
including death.
Slide 7. Ongoing high rates of infection in communities continuously leads to new infections, more and larger outbreaks, and spread into schools and high-risk settings such as hospitals, long-term care facilities, correctional facilities, and shelters, where spread is further amplified in closed settings. In particular, as community transmission has intensified, there have been an increasing number of outbreaks in long-term care facilities, ranging in size from a few cases to over 100. This is a difficult cycle of spread that can't be managed through outbreak response alone. Bringing infection rates down to stop the spread into these high-risk settings requires individual and public health authorities working together.
Diapositive 7. Les taux d'infection
Slide
constamment
7.
élevés dans les communautés
Ongoing
mènent
high rates of
continuellement à
infections
des
in
nouvelles
communities
infections, à
continuously
des
lead to new
éclosions plus
infections,
nombreuses et
more
plus
and larger
importantes,
outbreaks,
ainsi
and
qu'à la
spread into
propagation dans les
schools and
écoles et
high-risk
dans les milieux
settings
à haut
such as
risque, tels que
hospitals,
les hôpitaux, les
long-term
établissements
care
de soins de longue
facilities,
durée, les établissements
correctional
correctionnels
facilities,
et les
and
refuges où la
shelters,
propagation est
where
encore
spread
plus
is further
amplifiée dans
amplified
ces
in
espaces
closed
fermés.
settings.
Plus précisément,
In
étant donné la
particular,
transmission
as community
communautaire qui
transmission
s'est
has intensified
intensifiée
with
et
high
qui atteint
rates
des
of
hauts
infection,
taux d'infection, il y a une augmentation de
there have
nombre
been an
d'éclosions
increasing number
dans
of
les
outbreaks
établissements de
in
soins de longue
long-term care
durée,
facilities,
allant de quelques
ranging
cas
in
à plus
size
d'une
from a
centaine.
few cases to
C'est un
over
cycle de
100
transmission
cases.
complexe
This is a
qui ne peut
difficult
être
cycle
géré
of
par une
spread
seule
that
réponse
can't be
aux
managed through
éclosions.
outbreak response
Réduire les
alone.
taux d'infection pour
Bringing
arrêter la
infection rates
propagation
down to
dans
stop
les
the
écoles
spread
et les
into
milieux à haut
into
risque
schools and
nécessite
high-risk
que les
settings
individus et
requires
les autorités de
individual
santé
and
publique
public health
travaillent
authorities
ensemble.
working together.
Slide 8. The spread to Indigenous communities is another concerning trend, as Dr. Wong had already indicated. For example, as of December the 7th, Indigenous Services Canada reported a total of over 5,550 confirmed cases on First Nations reserves to date, including 2,080 active cases. 85% of the cases to date have been reported from the 3 prairie provinces. These case counts include several large outbreaks in Indigenous communities across the prairies and some small communities that are experiencing very high rates of positivity. The burden of COVID-19 in First Nations peoples is higher off reserve. As another example, Nunavut only recently reported its first locally acquired cases, which rapidly led to larger community outbreaks.
Diapositive 8. La propagation
Slide
aux
8.
communautés
The
autochtones
spread to
constitue
Indigenous
une autre
communities is
tendance
another
préoccupante.
concerning trend.
Par
For
exemple,
example,
en date du 7
as of
décembre,
December 7th,
un total de plus de
Indigenous Services
5
Canada
550 cas
reported a
confirmés
total of
dans les
over
réserves des Premières Nations a été
5,550
rapporté
confirmed
par Service
cases
aux
on
Autochtones
First
canadiens,
Nation reserves to
incluant
date,
plus de
including over
2080 cas actifs.
2,080 active cases.
85% des cas ont été
85% of the
rapportés
cases
par
to
les
date
3
have been
provinces des
reported
Prairies.
from the 3 prairie
Ces cas
provinces.
comprennent plusieurs grandes éclosions
These
dans les
case counts
communautés
include several
autochtones
large
des
outbreaks in
prairies et
Indigenous
certaines
communities
petites
across the
communautés
prairies and
qui
some
connaissent des
small
taux de
communities that are
positivité
experiencing
très
very
élevés.
high rates
Le
of
fardeau de la
positivity.
COVID-19
The
dans les
burden of
communautés des
COVID-19
Premières
in
Nations
First
est
Nations
plus
people
élevé
is
en
higher
dehors des
off
réserves.
reserve. As
À
another
titre d'exemple
example,
supplémentaire, le Nunavut
Nunavut
rapportait
only
seulement
recently
récemment
reported
ses
its
premiers
first
cas acquis
locally
localement
acquired cases,
qui ont rapidement
which
mené à
rapidly
des
led
éclosions
to
communautaires
larger
plus
community
importantes.
outbreaks.
Slide 9. Hospitalizations have been increasing for many weeks, following consistently elevated disease activity. Over the past week, an average of 2,900 people with COVID-19 were being treated in Canadian hospitals on any given day, including 565 of whom were in ICUs. On average, the length of stay for people hospitalized for COVID-19 is about 17 days, or about 24 days for those experiencing more severe illness. Critical care beds are at or near maximum capacity in many areas. This situation has put a strain on the healthcare system. Hospitals have had to make the difficult decision to postpone important medical procedures, which adds to existing backlogs and impacts the broader population.
Diapositive 9. Les hospitalisations sont en augmentation
Slide 9.
depuis de nombreuses semaines et font
Hospitalizations have
suite
been
à
increasing for
l'augmentation
many
continue
weeks
de
following
l'activité de la
consistently
maladie au
elevated
cours des
disease
3 derniers
activity
mois.
over the past 3
Au cours de la
months.
dernière semaine,
Over the
en
past
moyenne,
week, an
environ
average of
2900
2,900
personnes
people
infectées par
with
la COVID-19
COVID-19
ont été
were
traitées
being
chaque jour
treated
dans
in
les
Canadian
hôpitaux canadiens,
hospitals on any given
incluant
day, including
565 d'entre elles aux
565
soins
of whom
intensifs.
who were
En
in
moyenne, la durée de
high
séjour des
internet
personnes
intensive care units.
hospitalisées
On
pour la
average, the
COVID-19
length of
est
stay for people
d'environ
hospitalized
17
for
jours ou
COVID-19
d'environ
is about
24 jours pour les
17
personnes
days,
souffrant
or
d'une
about
maladie
24
grave.
days for those experiencing
L'occupation
more
des lits
severe
aux soins
illness.
intensifs a
Critical
atteint
care beds
ou est
are
presque à
at or
capacité
near
maximale dans
maximum
de nombreuses régions.
capacity in many
Cette situation
areas.
a mis à rude épreuve le
This
système de soins de
situation has put a
santé.
strain on the
Les
healthcare system.
hôpitaux ont dû prendre la
Hospitals
difficile
have
décision
had to
de
make the
rapporter
difficult
des
decision to
procédures
postpone
médicales
important
importantes,
medical
ce qui ajoute
procedures,
au
which
retard
adds to
existant
existing
et a
backlogs
un
and
impact sur
impacts the broader
l'ensemble de la population.
At slide 10, deaths are a late indicator of COVID-19 severity. Over the past week, an average of 100 deaths have been reported daily. Older adults are at highest risk, from deaths from COVID-19, with those aged 80 years accounting for 71% of all deaths, and those aged 60 to 79 years accounting for 26%. A majority of deaths continue to be linked to outbreaks in long-term care homes. People of any age can experience severe or prolonged illness due to COVID-19, and more than 35 deaths have been reported in adults under 40 years of age.
Diapositive 10. Les décès constituent
Slide
des
10.
indicateurs
Deaths
tardives
are
de la
late
gravité de
indicators
la
of
COVID-19
COVID-19
et peuvent
severity
survenir plusieurs
and
semaines
lag
après
behind
l'augmentation du nombre
increases
de
in
cas
reported
déclarés.
cases by several
Au cours
weeks.
de la dernière semaine,
Over the
plus de
past
100
week,
décès
an
ont
average of
en
100
moyenne
deaths
été
have been
signalés
reported
chaque jour.
daily.
Les personnes âgées sont les
Older
plus à
adults
risque de
are at
décès pour la
highest risk for death
COVID-19,
from
les risques
COVID-19,
étant le plus
with
élevé
those aged
chez les
80
personnes âgées
years
de 80 ans et plus.
or
Ces
more,
dernières
accounting for
représentent
71% of all
71% des
deaths,
décès liés à la COVID-19,
and
tandis
those
que ceux
aged
âgés de
60 to
60 à
79 years
79 ans
account for
représentent
26%.
26%. La majorité des décès continuent d'être
A majority
reliés
of deaths
aux éclosions
continue to
dans
be
les
linked
centres
to
de soins de
outbreaks in
longue durée.
long-term care
Les
homes.
personnes de tout âge peuvent souffrir
People
d'une
of any
maladie
age
grave
can
ou
experience severe
prolongée
or
due à
prolonged
la
illness due
COVID-19
to
et plus de
COVID-19,
35 décès
and more
ont
than
été
35
signalés chez
deaths have
les
been
adultes
reported
de
in
moins de
adults
40
under
ans.
40 years of age.
Slide 11. Based on Canadian data up to December 5th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to December the 25th, an important day. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 531,300 to 577,000 by December the 25th. The graph on the right shows the predicted number of deaths that could be in the range of 14,410 to 14,920 by December the 25th.
Diapositive 11. Sur la base des données canadiennes, en
Slide
date
11.
du 5
Based on
décembre,
Canadian data
les
up to
prévisions
December
à court
5th,
terme fournissent
short-term
le nombre prévu de
forecasting
cas et
shows
de
the
décès
predicted
dus au
cases and deaths
COVID-19
due to
jusqu'à
COVID-19
25 décembre.
up to December
C'est Noël.
25th,
Le modèle à
Christmas.
court terme continue
Short-term
de prévoir de
models
façon
continue to be
adéquate la
accurate
prévision de la
in predicting
trajectoire
the
de
growth
croissance.
trajectory.
Le graphique de gauche montre
graph
que le
on the
nombre de
left
cas prévus
shows the
pourrait se
predicted number of
situer entre
cases could be in the range of
531 300 et
531,300 to
577 000 d'ici le 25
577,000 by
décembre.
December
Le
25th.
graphique de droite montre
graph
que
on
le
the
nombre
right
de décès
shows the
prévus
predicted
pourrait se situer entre
number of
14
deaths could be in the range
410
of
et 14 920 d'ici le
14,410
25
to
décembre.
14,920
slide
by
12.
December 25th.
Here we have the longer range forecast showing how the epidemic could evolve in Canada over the next couple of months. The forecasted number of cases for early January is lower than 2 weeks ago because more stringent controls in British Columbia and Manitoba appear to be starting to control the epidemic there. Nevertheless, bending the curve of this resurgence, the blue line trajectory requires immediate, consistent, and strong combined efforts of individuals and local authorities in order to sufficiently reduce the current number of people we interact with each day. For all of us, that means we continue to maintain physical distancing, reduce contacts outside our household to essential activities, have good hand washing practices, and wear face masks to protect others and ourselves. For local authorities, implementing restrictions, closures, and control measures are required to achieve the reductions in contacts necessary to arrest climbing numbers. We are forecast to have 12,000 daily cases by the beginning of January, with increasing hospitalizations and death following this rise, unless significant reductions in contact rates are achieved.
Diapositive 12. Ces prédictions
Slide
à plus
12.
long terme montrent
This
l'évolution
longer-range
possible de
forecast
l'épidémie
shows how the
au Canada au
epidemic
cours
could
des
evolve
2
in
prochains
Canada
mois.
over the next
Le
2
nombre de
months.
cas prévus pour les
The
débuts
forecast
janvier
number of
est plus
cases
bas
for
qu'il
early
y a 2
January
semaines
is
en
lower
raison
than
de
2
mesures de
weeks ago
contrôle
because more
rigoureuses en
stringent controls in
Colombie-Britannique
British
et au
Columbia and
Manitoba qui
Manitoba
commencent à
appear to be
démontrer
starting
une
to control the
efficacité à y
epidemic there.
contrôler l'épidémie. Néanmoins, l'aplatissement de la courbe,
Nevertheless,
la
bending the
trajectoire de la
curve of
ligne
this
bleue
resurgence, the
nécessite
blue line
des efforts
trajectory,
combinés
requires
immédiats,
immediate,
constants et
consistent,
importants
and
de la part des
strong
Canadiens
combined
et des
efforts of
autorités
individual
locales,
Canadians and local
afin de réduire
authorities in
suffisamment
order to
le
sufficiently
nombre de
reduce the
personnes
current
avec
number of
lesquelles
people
nous
we interact with
interagissons
each
chaque
day.
jour. Pour nous tous, cela signifie que nous
For all of us,
continuons
that means
à
we
maintenir
continue
une
to
distance
maintain
physique,
physical
à réduire nos
distancing,
contacts
reduce
en dehors de
contacts
notre
outside our
foyer
household
aux
to essential
activités
activities,
essentielles et à
have
bien se
good
laver
hand
les mains
washing
et à porter
practices,
le masque
and
pour
wear
nous
face
protéger
masks
et
to
pour
protect
protéger les
ourselves
autres.
and others.
Pour les autorités
For
locales
local
chargées de la mise en œuvre des
authorities,
restrictions,
implementing
des
restrictions,
fermetures et les
closures,
mesures de
and
contrôle
control
sont
measures are
requises pour
required
arriver à
to
la
achieve
réduction des
reductions in
contacts nécessaires
contacts
pour
necessary
stopper la
to
hausse
arrest
des chiffres.
climbing numbers.
Nous prévoyons
We are
12 000 cas
forecast to have
par jour d'ici
12,000
le
daily
début janvier,
cases by the
ainsi
beginning of
qu'une
January,
augmentation
with
des
increasing
hospitalisations et des
hospitalizations and
décès
deaths
qui
following this
s'ensuivront à
rise,
moins que le taux de
unless
contact ne
significant
soit
reductions
réduit
in
de
contact
manière
rates are
significative.
achieved.
Our last slide, slide 13. Canada is at the starting blocks of its COVID-19 vaccine response. It is the best news we have heard for some time. Knowing access to safe and effective vaccines for all Canadians is within sight might lead some to think COVID-19 is no longer a problem. But the reality is very different. Canada and many countries around the world are still experiencing high infection rates. Nationally, we remain in a rapid growth trajectory. But the observed reduction in the longer-range forecast numbers since the previous modeling update demonstrates that when public health authorities and individuals work together to implement and adhere to more stringent controls, we can bend that curve. We need to rapidly reduce the strain on hospitals and our public health systems so that our health workers can keep the pandemic under management control at the same time as implementing the most complex vaccine program in our history. As 2020 comes to a close and the prospect of vaccines bring us hope, we must do everything we can to celebrate safely. With a bit of creativity and planning, we can still maintain our important traditions and social connections while keeping our families and friends safe. By now, our essential public health practices are as familiar as the layers we put on in winter, and we need to keep up with these for a while longer as we ring in the new year. Thank you.
Et finalement, le Canada est
And
sur la ligne de départ de sa
Canada is at the
réponse
starting
vaccinale
blocks of its
à la
COVID-19
COVID-19. Ce
vaccine
sont les meilleures
response.
nouvelles
It
que
is
nous
the
ayons
best news
entendues
we have
depuis
heard for
un
some
moment.
time.
Savoir que l'accès à des vaccins
Knowing
sûrs et
access to
efficaces
safe
pour tous
and
les
effective
Canadiens
vaccines
est en
for
vue
all Canadians
pourrait amener
is
certains à
within
penser que la
sight,
COVID-19
might
n'est
lead
plus un
some to think
problème. Mais
COVID-19
la
is no longer a
réalité est
problem.
bien
But
différente.
the reality
Le
is
Canada
very
et plusieurs
different.
autres pays
Canada
partout dans le
and
monde
many countries
font
around the
toujours
world are
face à des
still
hauts taux
experiencing high
d'infection.
infection rates.
À l'échelle nationale, nous
Nationally, we
demeurons dans une
remain in a
trajectoire de
rapid growth
croissance rapide,
trajectory,
mais le
but
ralentissement
the
observé,
observed
si on compare
reduction
les
in the
prévisions à plus
longer-range
long terme
forecast numbers since the
d'aujourd'hui aux
previous modeling
précédents,
update
démontre que quand les
demonstrates
autorités
that
de
when
santé
public health
publique
authorities
et
and
les individus
individuals work
travaillent
together
ensemble
to
pour
implement and
implanter
adhere to more
et
stringent
adhérer à
controls,
des mesures de
we
contrôle
can
plus
bend
rigoureuses,
that
nous
curve.
pouvons ralentir la croissance de cette épidémie. Nous devons rapidement réduire la pression
We
sur les
need to
hôpitaux et
rapidly
sur les
reduce
systèmes
the
de
strain on
santé publique
hospitals and
pour
public
que
health
nos
systems
travailleurs de
so
santé
that our
puissent
health workers
garder la
can
pandémie
keep the
à un niveau
pandemic
de
under
gérable
manageable
pendant
control
qu'ils
at
mettent
the
en
same
place le
time as
programme de
implementing the
vaccination
most
le plus
complex
complexe de
vaccine
notre
program
histoire.
in our history.
Alors que 2020 tire à sa fin et que la
As
perspective des
2020
vaccins nous
comes to
donne
a
de
close
l'espoir,
and the
nous
prospect of
devons faire
vaccines
tout
bring
notre
us hope,
possible pour
we
célébrer
must
en
do everything we
sécurité.
can to
Avec un peu
celebrate
de créativité et
safely.
de
With a
planification,
bit of
nous pourrons
creativity
quand
and
même
planning,
maintenir
we
nos
can still
importantes
maintain our
traditions
important
et nos
traditions
liens
and social
sociaux en
connections
gardant nos
while
familles
keeping our
et nos amis
families and
en
friends
sécurité.
safe.
À présent, les bonnes
By
pratiques de
now,
santé
our
publique
essential
qui nous
public
sont
health
autant
practices are as
familières
familiar
que les couches
as
de
the
vêtements
layers
qu'impose
we put
l'hiver,
on in winter,
et nous devons les
and we
garder un
need to
peu plus
keep up
longtemps
with
alors que nous
these for a while
célébrerons
longer
une nouvelle
as we
année.
ring in the new
Je vous
year.
remercie.
Thank you very much.
Merci. Nous allons maintenant
Thank
prendre
you.
les questions
We'll
des
now take
journalistes.
questions
Une question,
from
une question de
journalists.
suivi.
One
We'll start with 3
question, one
questions over the phone.
follow-up question.
Operator, over to you.
Thank you. Please press star 1 at this time. S'il vous plaît, appuyez sur étoile 1 pour toute question. Our first question is from Raymond Fillon. Première question est de Raymond Fillon de TVA. À vous la parole.
Raymond
Merci
Fillon,
beaucoup. Peut-être une
TVA.
première question
Our
pour
first
le
question
ministre Leblanc ou
for
le ministre
Minister
Hayou. Le Major
Leblanc or
Général
Minister
Fortin
Hayou.
disait avant-hier que
Major
les
General
vaccins devaient quitter la
Fortin
Belgique
said
vers le Canada
yesterday
vendredi, c'est aujourd'hui.
that the program should begin Friday. Do you know if the first doses are underway as we speak? Answer. Let me begin, and then either Dr. Tam or Minister Haidu can follow up. From what Major General Fortin confirmed yesterday during a meeting of First Ministers, everything is underway for vaccine delivery. He was very clear yesterday at the press conference that the vaccines are on the way to Canada. We are waiting their arrival. Thank you very much. Follow-up question for Dr. New, perhaps. What is most concerning in all this data that you're presenting to us today? I think worrying is perhaps the word. What is most worrying in your opinion?
Merci pour la question.
Thank you for the
D'après
question.
moi, c'est toujours le taux d'incidence
I think it's
d'infection, mais
always the
ce qu'on a vu aussi
incident rate.
aujourd'hui, c'est aussi comme les indicateurs
But as we've heard
tardifs,
today, there are
les
late indicators,
hospitalisations et aussi les décès. C'est
hospitalizations,
vraiment
deaths.
il y a beaucoup de pression sur notre système de
There's an
soins de
enormous
santé
pressure
aussi,
on our
de
healthcare
santé
system
publique.
right now.
On est presque, je pense que dans quelques régions du
In a
pays,
few areas of the
presque
country,
à point d'être débordé. Et on
we're
a déjà
at the point
reporté
of
les
being
procédures
completely
médicales
overloaded.
importantes.
We've postponed
Ça, c'est
important
pour moi,
medical
c'est vraiment important
procedures,
parce que c'est une
which is a
indication
very
des autres
important
conséquences,
indicator for me
à
of the
part de
other
seulement
consequences
concernant la COVID-19. Donc, ça,
of
c'est quelque chose à suivre
COVID-19.
et on espère que
This is something that will need
les
to be closely
indicateurs
followed,
tardifs
and we hope
vont
that these
aussi
late
peut-être
indicators
commencer à diminuer. Mais
will
c'est
begin
toujours
to drop.
quelque chose à suivre dans quelques semaines.
But this is
Ce qu'on
something we
fait
really need to
aujourd'hui,
follow.
on va voir les
What we
conséquences dans
do
quelques
today
semaines.
will have
Merci.
consequences in the coming weeks.
Merci, Raymond. Prochaine question.
Next question, Raymond.
Thank you. Merci. Prochaine question is from Dylan
Next question.
Robertson from Winnipeg Free Press. À vous la parole. Please go ahead.
Hi, Minister Miller. I wanted to ask about expediting vaccine quota for Indigenous people inside provinces. The Manitoba Premier said Tuesday that Ottawa has boosted the Q1 allocation of Moderna by 15% for Manitoba, that this was in recognizing the elevated risk for remote First Nations. I'm still waiting 3 days later for Health Canada to confirm if that's actually happening. The Premier also said yesterday that your government will not similarly expedite doses for urban Indigenous people. So I'm wondering if you can confirm any of this, and if you could also list which provinces are getting expedited allocations and how much we're talking about.
Well, thanks, Dylan. I think you're touching on a key element of our Medicare system, which is one of universality and fairness. And I would refer you back to the national guidelines that were issued last Thursday on the prioritization of populations. There's a cascade of prioritization based on essential health workers, people living in congregate living conditions, and Indigenous peoples. And you may ask yourself, what's the reason for that? Well, I think it's pretty obvious that Canadians expect our health delivery services to be fair, and we're talking about people that are in a position of vulnerability. As to answering directly your question, and I'll pass some of it over to Dr. Tom Wong. It's key as we look at the cascade of deployment and cognizant that we are in the initial phases and we're talking about preliminary amounts that will be distributed to 14 points. You're talking about a conversation that'll be a lot more timely in short order, and I think it's important to remember that there is some time before we get effective deployment of other vaccine vectors, but it's to underscore the importance of the vulnerability of Indigenous peoples. I mean, we need only look to some of the numbers that we're seeing with our partner to the south of us to see numbers of 3.5 to 5 times greater in Indigenous populations in the United States in terms of the impact and spread of COVID. And the impact on Indigenous peoples is devastating. That is for a number of socioeconomic reasons. And the impact on the healthcare system is correspondingly quite strong. So when we're talking about urban Indigenous populations, remote and northern populations, we need people to be focused on that. And I think Canadians expect us to be focused on those numbers and the deployment of the vaccine in order to, one, protect those populations and ensure they get first care healthcare service in a country that we pride ourselves on that healthcare service and hasn't provided it to Indigenous peoples in the past. But also in urban areas where we need the partnership with the province. And that's a hand that I extend to all premiers, and including the territories, to make sure that is deployed in a way that represents what all Canadians expect, which is a fairness in the healthcare system. As to quotas and allotments, that conversation is very early, and on that point, I'll pass it over to my Chief Medical Officer, Tom Wong.
Thank you very much for the question. From a public health perspective, the vulnerabilities of First Nation, Métis, and Inuit people, wherever they live, whether it's in the north or in urban centers, this is extremely important. One of the important aspects, is the importance of sitting down together, with the province, with the territory, with the federal government and First Nation, Métis, and Inuit partners. We walk this path together. It's only when we discuss together the plan forward that we can actually resolve, these issues about inequalities, inequities, and address, the vulnerabilities. Thank you.
If it's okay, I'll just jump in just to add some clarity. The decision has been made, and it is on a per capita basis with additional allotments for Indigenous people, so on First Nations. And so I think, Dr. New, you've been involved in that conversation. Just for clarity purpose, let's be very clear here.
Okay, so certainly from the public health perspective, as I indicated earlier, I think on Wednesday, we've had good discussions, and so within the public health community, it's quite clear. I'll restate that. We're talking about 6 million doses overall for the first quarter. And what's interesting is that the combination is between Pfizer and Moderna. So 4 million doses for Pfizer and 2 million doses for Moderna. But at this point, we only have one approved vaccine, that's the Pfizer vaccine. So much of this planning is taking place with a vaccine which has not already been approved. And so as we indicated earlier, the territories have indicated to us that for their planning purposes, it's difficult. The Pfizer vaccine, I guess the term is, it's fragile. It has to be used under very strict conditions. It doesn't make sense for them to accept their allocation with the Pfizer vaccine. And so they indicated a preference to receive the Moderna vaccine once it becomes approved and once it becomes available. And of course, the shipping and the delivery schedules, that'll all have to be taken into account once that's approved. And so if you look at the territories, that's what they want. I can appreciate also then in certain provinces, especially for their maybe northern communities, it might be the same issue as it might be for the territories. And so in terms of actually figuring out the ratios of what vaccine, the timing of deliveries and so on, that's a live issue. But I think as Minister Haidu has also indicated, at the end of the day, it's a per capita allocation. Thank you.
Do you have a follow-up, Dylan?
Thanks especially to Minister Haidu for that clarity. I just wanted to know the numbers that we're talking about in quarter one, whether that's on a provincial basis or just across Canada, if you're able to say how much of the Moderna dosage is meant to be, increased per capita, over the per capita to make up for Indigenous communities. And is this strictly to uphold Ottawa's fiduciary duty to First Nations on reserve, or will this include Métis people and non-status?
Well, I think first of all, what we have to be clear is that the Moderna vaccine is not approved yet. So those discussions on how the Moderna vaccine will be distributed are ongoing. But in general, as Dr. New has illustrated, it is on a per capita basis. It is with additional doses for the federal populations that the federal government are responsible for, that is people on First Nations and living in First Nations communities. But I think to reiterate what Minister Miller is saying is that we expect in urban populations that Indigenous people, including Métis people that are living within urban populations, are treated like every other Canadian in that population and have access in an equitable way. And if I can be so bold to say, I think that is what Minister Miller laid out as the expectation for all premiers and for all provinces and territories, that this is their fiduciary responsibility, or their jurisdictional responsibility in urban centers. There is no distinction, by the way, when a person lives in a city like Thunder Bay who is Indigenous or not. They have exactly the same rights to access to care and health care as a non-Indigenous person. And so I think what we all expect is that the National Advisory Committee recommendations are applied at the provincial level and done so in a way that's equitable and fair.
Thank you. We'll take one more question from the phone and then take questions from the room.
Merci. La prochaine question nous vient de Émilie Bergeron, agence QMI. À vous la parole.
The next question from Émilie Bergeron, QMI Agency. Question. You're saying that as long as there's no reduction in the contact between Canadians, we can't flatten the curve. There's the danger of quick spreading of the disease. But how can people reduce their contacts? Are you asking provinces to implement stronger measures?
Merci pour la question. C'est Dr.
Answer.
New.
Thank you for the question. This is
Je pense
Dr.
que
New
c'est vraiment des
speaking.
bonnes nouvelles avec
think that
l'introduction des vaccins ici au
The
Canada.
introduction of vaccines here in Canada is good news, and that may be as of next week. I think it's very important, however, and we must emphasize this, that we continue to follow public health measures. As I stated in my speech, there is always a combination of individual efforts, that is Canadians' individual efforts, and the efforts of authorities, for example, local public health authorities. The goal is to limit the number of contacts, and if we do have contact with others, to use several layers of protection, masks, wearing masks, washing one's hands frequently. This is what should be done at the local level. If we see with the epidemiological data that a certain region of the country has a very highly increasing rate of infection, then perhaps local health authorities will have to implement stricter measures. If everyone follows the measures, however, the rate will perhaps drop, and then we'll have the possibility of easing up on these measures. We'll have to wait for the new situations as they arise. Of course, winter is going to be very difficult, even with the introduction of the vaccine in the first quarter of 2021. We have a limited number of doses. We hope that by the second quarter, as of April, there will be more vaccines available for more and more Canadians. But throughout winter, we have to continue our efforts. The danger with winter is that more people congregate inside. That's why it's so important to continue these public health measures.
Emily, est-ce que vous... Oh, désolé, allez-y avec
Go ahead,
une question de suivi.
Follow-up question.
Au niveau des nombres des signalements quotidiens,
with regard to the reported daily
à votre dernière
cases,
modélisation, vous parliez de
when you last
20
modeled
000 cas par jour
these
à 20,
results, you had
60 000
20,000
les
cases
niveaux de contact
a
augmentaient.
day
On est rendu
and
où
even
maintenant dans
higher.
les projections d'aujourd'hui
What
pour les cas
about
quotidiens?
today's forecasts?
Actuellement,
Answer.
on a
Currently,
toujours des données, on reçoit des provinces et territoires.
we
Je pense
are
que Dr. Tam et moi, on a
receiving
dit que
provincial
si la
and
tendance
territorial data.
continue, on peut même
I think
avoir
Dr.
peut-être
Tam and
comme
I
12 000
say
cas.
if the
Ici,
trend continues, we
le
can
mois de
expect
janvier,
12,000
mais,
cases daily
On a vu
by
aussi que
the month of
les
January.
efforts, qu'est-ce qui
But
se
also
passe
see
actuellement dans les provinces et territoires, c'est une
current efforts
combinaison
in the
des
provinces
mesures
and
d'implanter
territories
des
are a
autorités, mais aussi
combination of public
les
health
actions
measures
des Canadiens
and
Canadiens.
individual
On
measures.
commence
That is
aussi
what Canadians are doing.
ralentir la croissance de cette épidémie.
We're slowing down the
Donc,
growth
je pense que,
rate.
il ne faut pas seulement regarder qu'est-ce que est possible
We're
dans
beginning
quelques
to slow
semaines
down
ou
the
dans
growth
quelques
rate.
mois. C'est
We
très
need to
important.
see
Qu'est-ce qu'on fait tout le monde maintenant,
If we want to know what's going to happen in a few
actuellement.
months, we need to look at what we're doing right now.
Minister Haidu, a few months ago, you said you were concerned about people buying their way to the front of the testing line, and we're going to get your department to look into that and make some recommendations. As far as I know, nothing happened on that. Now we hear that the NHL is or was considering buying vaccines privately for their players. Are you going to do anything about that? And do you think it's right that private corporations or individuals should be able to buy vaccines privately and use them?
Well, thank you very much. Listen, corporations always have the opportunity to procure equipment, supplies, tests, medication, and many do around the country. There are private benefits. For example, I worked previously with many trades unions that have private benefits and private services for their members. But what I'll say is publicly acquired goods will not be able to be purchased by private corporations.
So you're not going to do anything. It's okay if the NHL or some other businesses decide to buy crucially scarce vaccines on the private market and give it to their members or employees before other people in the general public have a chance to get it. You're cool with that?
Well, I think you're putting words in my mouth, but what I would say is that we don't have any mechanisms to block corporations from purchasing on a private contractual basis with corporations around the world. Listen, these are individual corporations that are selling to a variety of countries and selling to a variety of actors. I don't know the details of Pfizer's, for example, corporate contracts with other countries, but I will say this: anything the government of Canada procures for citizens will not be sold for a fee. We regulate. So I'm happy to turn to my colleagues in a moment, but I will just say this. The regulator's job is to ensure the safety and efficacy of the goods and products, including medication and vaccines. The regulator's job is not about access. It's about the safety and the performance of the products, making sure they stand up to their claims. I don't know if I've missed anything, doctors.
Thank you. David, would you like to go ahead?
Yes. Good morning, everyone. Thank you so much for joining us. David Thurton, CBC News. Just wanted to talk about the cases that we're seeing in long-term care. The data shows that they are rising. And so maybe someone could explain to us, how is it that after the horrors of what we saw in the first wave in long-term care, that these places remain so exposed to infection? I mean, I thought we learned the lessons that we were supposed to learn. So could someone just explain that to us? Like, what's going on there?
I can start, and then I'll turn to Dr. Tam. And I'll start with just the supports that we've given to provinces and territories to set the stage. During the Safe Restart Agreement, $740 million of the $19 billion was set aside for supports for infection prevention control to help provinces and territories strengthen those processes to deliver on their responsibilities to people in long-term care. We've also supported with additional rapid response programs. As you know, we have, I think, I have a number here, as of yesterday, 401 Red Cross staff in Quebec, Ontario, and Manitoba homes. We've also shipped over 8.6 million rapid tests to provinces and territories, which some of them have begun utilizing as a screening tool for staff and potential infections that are presenting in long-term care. But I think it's an indication that we have a patchwork quilt, if you will, of standards across the country. And another commitment of the government through the fall economic statement was to create long-term care standards and support in part financially the provinces and territories to do that. And you're right, it's a tragedy. When we talk about the numbers of people dying, these are family members. I have a dear friend in Thunder Bay who just reported that her father passed away in Roseview in Thunder Bay just this week. These are people's fathers and mothers and loved ones who, in many cases, have many years of life ahead of them, actually, happy years of life ahead of them that have been taken too soon. So I know provinces and territories are having varying degrees of success of implementing infection protection control. Some of it has to do with, obviously, inspection regimes. We have expert group that Dr. Tom and I speak to on a regular basis. And in fact, one of the experts is working in the jurisdiction of BC and talked about just the rigor involved to keeping COVID-19 out of long-term care homes. 24/7 process focused on many different aspects, including cleaning and screening, but the rigor is significant. And finally, the more community spread, the more of us that are infected, the more likelihood someone that works in a home will come into contact with COVID-19, and as we know, can be very mildly ill and can spread the disease to obviously really vulnerable people. Dr. Tim, did you want to add anything?
There really is not much more to add. I think, obviously long-term care is a complex environment within the jurisdiction of the provinces and territories, private sector. There's so many different constructs, and it's difficult to ensure, I think, that every long-term care home is sort of to the same standards and rigor. I do want to just stress the last point. One of the last points that the minister said is that if you have community spread, it's awfully difficult to keep it out of these homes, so which is why some of the support that everyone can do to reduce the community level of transmission, then we expect the outbreaks to be reduced as well. I think that many jurisdictions are beginning to do the testing and screening, so we'll see if that helps. The infrastructure piece, I think there's more support really going to long-term care because some of it is sort of long-term infrastructure pieces. Some jurisdictions actually have people in individual rooms, for example, and others have more than one person in a room. So I think there's some very varied reasons. But in talking to other chief medical officers, no matter how hard you try, if you got very much rapid growth in the community, it's really difficult to prevent them from the virus completely from these kind of high-risk settings. So, we just really need to be vigilant. But many layers and layers of screening and protection is what we're trying to do. Someone say, the Swiss cheese model where every layer is imperfect, but the more layer that each individual organization can put on, the better. And then we're here to essentially help and support.
Similarly, as we talk about long-term care, we could talk about what's happening in Indigenous communities. I mean, they were doing so well before in the first wave. Similarly, Minister Mark Miller, what went wrong there?
And it's an excellent point, David. Communities are fighting against odds that wouldn't exist in non-Indigenous communities. And as I mentioned in my answer to Dylan, we don't have to look at H1N1 where we saw the odds. It's a bit of a pale specter compared to what we're actually seeing in the U.S. in a number of communities. And if you compare communities, for example, the Blackfoot in Alberta and the Blackfoot to the south, the numbers are much greater. So there's things that worked during the first wave, but there's no magic to keeping COVID out of a community. It's vigilance, the adherence to the health protocols, tracking, tracing, isolating, making sure that communities have the resources. But you're fighting against, we're pushing back overwhelming odds stacked against Indigenous communities based on historic inequities, access to healthcare system, poor health infrastructure in communities, as well as the challenges that are faced in urban situations with respect to Indigenous communities, as we see the numbers in ICUs and hospitalizations in Winnipeg, for example. We constantly assess and reevaluate. I think a lot of the ministers that are in the mix and working every day to keep people safe wake up every day and ask themselves how they can move faster to help people. But COVID moves extremely fast, and when it gets into a community, when people let their vigilance down, when economies reopen, this spread is inevitable. But it is not a challenge that we can't overcome. There's some communities like Cross Lake, the military that went into Opaskwayak in their long-term care facility and did some amazing work along with Chief Christian Sinclair. There's amazing work being done in communities. There are other communities that are challenged, and they have to keep implementing their pandemic plans. Some of the measures that we implemented in Indigenous Services Canada in juxtaposition to what we did in the first wave of COVID are more tailored and addressing the inevitable surge. We knew this was going to happen, and we warned. We're still fighting those incredible, overwhelming odds, but tailoring those resources, including ensuring communities first have the financial backing of Canada, making sure they have physical resources, isolation units, repurposing common areas like schools and gymnasiums to deal with the surge. And extreme circumstances. And I would say, although every community has a pandemic plan, There isn't really one that plans for the arrival of the military, because these are really really catastrophic scenarios. For example, like, as what we're seeing in Shamattawa, in northern Manitoba. Our approach from the very beginning is to ensure that Indigenous communities are not left behind, and there are unique situations to each community that make tailored measures really important. We'll continue to work with them, but this is going to be a couple, 3 or 4 or 5 difficult months as we see the increased stress on mental health during the winter months, as well as the challenges in overcrowding. And overcrowding is a huge issue. Every chief I talk to that has an increase in COVID in their community talks to me about the medical supports they need for their people. And the almost immediate conversation after that is about housing, because if you have one person in a congregate living space that's multi-generational, you're talking about pretty much 19 or 20 cases if they have 10, 15, 20 people in that housing. It's an issue that COVID has brought to the fore. It has existed prior to COVID. We look at Inuit communities where overpopulation exceeds 50%. They have 300 times the rate of tuberculosis, which follows a very similar vector to what COVID does. So you asked me what went wrong. There was already a lot wrong before we went into COVID, dealing with the historic inequities, and those are the cards that were unfortunately dealt, and we're dealing with them. And that means deploying resources of the Canadian government to ensure that communities have the resources they need. That means constant communications with communities that have those spreads, and adapting to the situation at hand, and in ultimate cases, bringing to bear resources that only the Canadian government can bring to the table, including the armed forces.
Thanks. We'll take another question from the phone.
Thank you, merci. La prochaine question est de David Aiken from Global News. À vous la parole, please go ahead.
Well, thank you very much, folks. I guess it's probably for Mr. Miller at this point in time. Just to come back to this issue of those Indigenous people, those First Nations members of a First Nation reserve living off reserve. And I think maybe the context for Premier Pallister's issue yesterday was there seems to be a fair public health imperative to prevent travel from people who are members of a remote reserve in northern Manitoba, but may be living in Winnipeg, from returning to their remote reserve in order to get a vaccine. Similarly, there will be First Nations communities. I think of the Tsuut'ina in Calgary. I think of Fort William First Nation next to Thunder Bay, Flying Post next to Nipigon. Those are next best things to urban reserves. They'll be able to get the Pfizer vaccine because Tsuut'ina is very close to Calgary. So I wonder, and I take note as well that Alberta's rules for handing out vaccines, their number 2 priority group in Alberta is simply adults over 65 in an Indigenous community. It's not Indigenous people in an Indigenous community, it's adults, and that would seem to make sense if you want to protect the community. So maybe you can talk about how you and the province are talking about trying to prevent or give incentives to make sure people are not traveling from urban areas to remote areas, and also being able to distribute Pfizer vaccines to those Indigenous people who do live and their reserves are very near a central facility for that vaccine.
David, I think Patty and I will answer this in parts. You're assuming a lot of premises to draw the conclusion that you're drawing that have various levels of accuracy to them. I think if you ask any First Nations leader, and I think they've been quite vocal about that risk of travel, it was one that is much lower than was presented. But clearly, the medical and moral imperative is to ensure that Indigenous communities are properly served by the Medicare system. When we start following the cascade of prioritization that exists in that the National Advisory Group has set forth, that requires an immense work in logistics and an immense cooperation with provinces. And when you talk about urban populations in particular, you see the limited effective ability of the federal government to implement its jurisdiction. I know Dylan talked about fiduciary duties, but we could get into a long conversation about the fiduciary duty to Indigenous peoples that incumbent at the same time on the federal government as it is on the provincial government. But the point here, and I think this is important to remember, is we've got 2 principles here. the fairness of the medical system that all Canadians hold high. And then secondly, the importance of ensuring who does what in the most effective way. And that is a challenge in logistics that in large part we've involved the Canadian Armed Forces to ensure that if there are mistakes being made, we're ready to pick up the ball and run with it in relatively short order. And that's what Canadians expect us to do. This is the largest deployment of vaccine in history. And Canadians expect us to deploy it in an effective way. We're talking a lot about jurisdictions, but what's important to remember is there are a lot of incredible civil servants working night and day to ensure this vaccine delivery vector, and again, assuming there are further approvals of other vaccines, is done in the most effective way so that all Canadians have the opportunity to get vaccinated. And we although those promising announcements this week are something to be quite proud about, we're not out of the woods yet. There are many months ahead of us, and if we look at the numbers, for example, and the projections that were brought today, there's a lot of things that have to fall into place before everyone has the opportunity to be vaccinated. And this is about fairness, and it's about ensuring that we have that prioritization established with provinces and territories, northern and remote communities, and in the case of the work I do on a daily basis, urban Indigenous groups as well. Patty.
I'll just add, David, that the national advice, the NACI advice on prioritization is being continually refined as we learn more about the types of vaccines and what they might be best indicated for in terms of populations. And secondly, that advice is being worked through at provincial levels, and the provinces will do the determination of how they prioritize within their own jurisdictions. We haven't seen indications that provinces and territories are going to abandon the NACI advice. In general, they understand the imperative that it is about saving lives. Those who are most at risk of dying from COVID-19 are prioritized. Those who are most exposed to COVID-19 are prioritized. And so I understand that it's a confusing time because, of course, as we see these first few doses arrive, we have a situation of sparsity, but over the next several months, all things considered and approvals forthcoming, et cetera, we have hundreds of thousands, if not millions of doses arriving. And the good news for Canadians is that everyone who wants a vaccination will be able to get vaccinated by the end of the year, of course, providing we get approval of these vaccines, et cetera. But we have purchased enough as a country, and we certainly have enough planning involved that we will be able to vaccinate all Canadians by the end of 2021. And maybe even sooner, depending on the manufacturer delivery dates and a variety of other factors that we at the Government of Canada don't control. So I think we have had a very good relationship through the various technical working groups, Dr. Tam's committee, and the variety of other folks that are working on immunization and vaccination. And I will just say that at the Minister of Health level, we also have had a very good relationship. And I'm confident that we will be able to vaccinate in a priority sequence that has the first goal in mind, which is to save lives and further than stop the spread of COVID-19.
Okay, thanks. I guess the NACI recommendations have Indigenous communities sort of number 4 priority group. Alberta's got it number 2, Ontario number 3. So the provinces have made it, they put a much higher priority on getting Indigenous people or Indigenous communities safe. Anyhow, Minister Hajdu, question for you. Why not make the COVID alert mandatory, the COVID alert app mandatory on devices where the federal government has authority, i.e. all federal government workers, CAF, maybe look at federally regulated industries, banks, airlines, telecom. There's a lot of power the federal government might have to make sure that where it can do it, it puts that software on those devices.
Well, thanks, David. It's an excellent question for the former Minister of Labor. I would say that those conversations would have to happen in partnership with employers and their federally regulated unions, and I would be interested to hear the perspective of the labor movement, the federally regulated labor movement. As we've always said, this is a voluntary app that Canadians really should download as an extra tool. It doesn't use memory in any significant way. It doesn't drain your battery. It has been vetted by the Privacy Commissioner, and in fact, part of the Privacy Commissioner's notes was that it was voluntary and that this isn't a mandatory app for Canadians to use, but it is a very useful tool, and I would encourage people all across the country to download COVID Alert, even if you're in a province or territory who doesn't currently have the app loaded, you can still use it, because if you come into contact with someone from another province who has received a diagnosis, then it would alert you in those cases as well. So I encourage all Canadians to download COVID Alert app today.
Thank you, David. And we have time for one last question. Please go ahead.
Dr. Tam, I want to ask you about Moderna vaccine again. Provincial and provincial and territorial authorities are talking about receiving doses of Moderna's vaccine. How close to approval it is, and how many doses these authorities, these provinces and territories were told they would receive in the first deliveries?
Just like with the Pfizer vaccine, we do a lot of pre-planning with a certain assumption, and with the assumption that it would get approved. We don't know yet, but all I know is my Health Canada colleagues are working day and night 24/7, and so that I think one would expect them to have that analysis soon. But you would have to go back to the regulator, because they are an independent reviewing organization. But I think that they are, as I think Dr. Sharma had indicated, very optimistic. They're working really hard. So then we plan ahead, just as we did with Pfizer vaccine. We know that we expect 4 million Pfizer, 2 million Moderna, if all goes well. So those are the numbers that we're working with. And as the ministers have said, the general principle is a per capita one. However, because the handling of these two vaccines is so different, the key is the consultation and discussion with the different partners. So as a result of that discussion, for example, the territories indicated that, look, the Pfizer vaccine just isn't the right fit from a logistics perspective, and that we would look towards the provision of Moderna vaccine for them. And because of the remoteness and the winter and the access, then they get forward delivery of more Moderna vaccine, upfront, as it were, so that you're not sort of going in there more than once into remote communities. So those are the sort of feasibility and acceptability aspects of the planning, and so and then other remote communities as well, and that's why there is this sort of front loading of some of these remote access communities with the Moderna vaccine. The bottom line is the $6 million as a whole is a per capita concept. And so I don't know if that answers your question. Planning is well underway just to prepare the individual points of delivery, and the discussions with Moderna, like the sort of daily touch base, so that we know how to plan for that, just as we did with the Pfizer vaccine.
I want to also hear some of your thoughts on the sort of whispered lockdowns have been imposed in other countries and other jurisdictions like Germany, Britain, where they have seen, like us before, in the last few weeks, wide increase in cases. What are your thoughts on the efficacy of such move to improve, to impose a circuit breaker, a lockdown on the country for 2 weeks or more?
Yes, so I think, again, we presented our data, and each province and territory in a very different context. And I think, locally or otherwise, they have to look at what's working and what's not. But, for example, one jurisdiction that did sort of turn themselves around a little bit in the last while is Manitoba. So we know what they did is we're beginning to see what is going on with the measures that they've taken. And I expect, given this kind of projection, other jurisdictions will be looking at what they may need to do more of. Alberta, for instance, just announced more measures. So that will take a little bit of time to see what actually happens, because it's just happened recently. But they, of course, looked at their information and figured that, look, hospitalizations and other indicators are trending in a certain direction, and this is what they need to do. But there is no doubt that reducing contact rates will get your curve down, and that's what the modeling is showing.
Thank you.
Glenn McGregor, CTV News again.
It's actually our last question.
One more question. Minister Heidi, you look at those numbers and they're pretty clearly a disaster. The curve for the projection cases is a hockey stick going up, and you're here talking about downloading an app and giving the sort of same message about moral suasion and washing your hands you've been giving for months. At what point does the federal government intervene, actually impose public health measures on the entire country? Is there a number of deaths we have to reach or a number of cases? I mean, at what point do you actually start taking some real action on this?
Well, first of all, I would say that we've been taking real action since the introduction of COVID-19 to Canada. And I want to thank Dr. Tam and New for working, and actually Dr. Wong, who's here, who I don't know as well, but who have been working literally around the clock to try and protect Canadians. But we do live in a federation, and we have worked collaboratively with provinces and territories. That has been our approach all along. We've been there for provinces and territories with money. 8 out of every $10 spent on COVID-19 has been federal money. We've been there for provinces and territories with tangible supports, including people, expertise, equipment. We've paid for all of the personal protective equipment, all of the testing, as you've recently heard, all of the vaccination, including the delivery and the logistics. We've been there for Canadians with economic supports to stay at home, with economic supports for reduction in business, with economic supports in terms of wage subsidies to keep as many people employed as possible. And as a matter of fact, Canada has been recognized for those efforts around the world. And yes, it is a tragedy. I completely agree with you that cases are rising. They are rising globally. There are very few countries that are not seeing growth right now. But I will tell you this, I believe it's that effort of partnership and that we will do whatever it takes attitude that will get our country through this. And I am counting on Canadians this Christmas to protect each other. These holidays are going to be very difficult, and I'm counting on Canadians to take care of each other and protect each other because we can do it. We can do it for just a little longer, and we do see the light at the end of the tunnel, but we need to continue our hard work, and we need to continue to support each other, even if it's at a distance. Thank you.
Thank you. Thanks, Glenn. That's all the time we have today.
Thank you. Your conference is now over. Votre conférence